Dr. Hassan, can you provide an overview of the latest treatment options for advanced bladder cancer, and in particular, the role of immunotherapy and how it works to treat bladder cancer?
Absolutely. So this is actually a really exciting time in bladder cancer treatment because for a couple of reasons. I'd say there's two kind of main frontiers. I'll address the immunotherapy first. So for the longest time, we were treating bladder cancer, particularly metastatic bladder cancer, i.e. incurable bladder cancer with platinum-based chemotherapy. So chemotherapy is cytotoxic, meaning it's all throughout your body, it's systemic, and it kind of kills everything. It attacks everything. Tumor cells are more susceptible to this type of treatment because they have high cell turnover. And as they turn over, they're more exposed, your DNA is more exposed to these mechanisms of cell kill. And so they're differentially affected, but it still does a number on the rest of the healthy tissue in your body. Immunotherapy is newer, and it's a type of treatment that basically inhibits the inhibition of your own immune system. In other words, it helps the immune system work better. And that's important because the immune system is one of the main tools in fighting cancer. It does recognize these cancerous cells as not necessarily foreign, but abnormal cells that shouldn't be there. And so it does help your body, attack those cells. And when it does that, it's more selective than the cytotoxic classic chemotherapy that we use. And so we're adopting this immunotherapy in more and more cancers. Bladder is one of them. And just, I want to say, in the past 6 months, they had a really big study that compared classic platinum-based therapy to a combination of pembrolizumab and infertumab, which is Padcev. It's called an antibody drug conjugate, an ADC. It's another mechanism that it works in conjunction with immunotherapy to kind of better isolate these tumor cells and destroy them. And that showed like a dramatic increase in survival and disease control compared to classic chemotherapy. So that's doing really well, and we hope to see that more in earlier and more curable stages of disease as well. So that's an exciting frontier. The other aspect I would say is we're seeing more and more bladder preservation. Now, I'm a radiation oncologist. I might be biased in this topic, but historically, we've always treated curable bladder cancer with a combination of chemotherapy and surgery. So we remove the bladder in its entirety, you remove the cancer with it, and then you give systemic therapy to prevent any like stragglers, we'll call them, like cancerous cells that are just left behind. And this has been effective, but of course you lose your bladder, and so this is at the end of the day, if you can preserve it, if you can preserve the organs you were born with, you want to do that. And if you, instead of doing a cystectomy, which is removal of the bladder, if you do a combination of chemotherapy and radiotherapy, and probably in the future immunotherapy all together, you can have the same chances of cure, same chances of survival, but preserve the bladder. So we're seeing that more and more these days.
Okay, thank you. I do have a follow-up question to that also. So if a patient is watching this, maybe lives in a
Mhm,
smaller community, doesn't live near a big academic center, are
mhm.
these immunotherapies in clinical trials only, or are they being used at more local centers? And then also for things like radiotherapy, how about that type of therapy also? Can they access that at their local cancer center?
Great question. So immunotherapy at this point really should be everywhere. It really, really should be everywhere. It should not be difficult to access, whether you're in a rural community or in a big, level 4 academic center. I think radiation can be more variable, not because of the access, because frankly, you should be able to find a radiation oncology clinic within, I don't know, a half hour of anywhere that you are in the country. I think there's enough of those clinics in the country. However, it just varies place to place as to the types of treatments that they're comfortable doing. And also as an institution, it is a multimodality approach. You have to have a urologist to buy in, you have to have the medical oncologist to buy in, and the radiation oncologist to buy in. And that can just change institution to institution. In either scenario, when it comes to an activation tip, I would say do not settle for what's offered to you if you know that these other options are available. So, you do a simple Google and you find out what are the treatment options available, and then you just mention them to your local oncologist. And, I think the vast majority of them, whether they provide them or not, will tell you, oh, yeah, that is an option. We don't do that here, but please check out these other places. And so don't kind of settle for just, if they just give you one approach and that's it, they don't mention anything else, you got to question that a little bit. But I think the vast majority of providers will at least tell you, acknowledge that there are other options out there.